But again, it can, just like all of these things, can lead to the medicalization of birth. So you're
Yeah.
required to have IV fluids. You're required to have continuous fetal monitoring. You have to stay in bed, at least in our area. So that definitely is a downside.
Well, and
So,
something else to say, like it has fewer side effects, but I also feel like epidurals tend to lead to more of a cascade of interventions than narcotics do. Hi, I'm Rachel, owner of the Natural Birth site, certified birth doula, childbirth educator, and midwife's assistant.
And I'm Tiffany Muniz, certified birth doula, lactation counselor, and midwife assistant.
Here, you'll learn all about different aspects of pregnancy, birth, and postpartum.
Remember, none of this information should take the place of your care provider and is not medical advice.
Birth is not a medical emergency.
Thanks for listening.
Hey everyone, welcome to the Natural Birth Talk. I'm your host, Rachel.
and I'm Tiffany.
And today we are talking about pain meds. This is our 5th episode in our intervention series.
That's crazy.
I know, we're 5 episodes in. I think we have 1 or 2 left.
A few more, yeah.
And then we have our question and answer series / storytelling. Not series. Question and answer episode / storytelling episode.
Which I'm so excited about.
I am. We've already got several questions stacked up, but if you guys have any stories or questions, please send them to us and we're happy to read them or answer them online. Gosh darn it. Why can't I talk? Tiffany, listen. My brain today. I am on my 3rd cup of coffee. Tiffany and I have both been up since like 5 a.m. this morning, not planned. Just our children were in bed with us and we couldn't go back to sleep.
Right, exactly.
So we'll see how this episode goes. I'll probably have to correct myself 20 more times.
That's all right. We can edit it out. I mean, you
can
edit it out.
I can edit it out, yeah. Or I might just be like tired and leave it in.
Just leave it in, right.
And just let you guys laugh at us.
Yeah.
Anyway, so if you have questions about any of the interventions we're talking about or a different intervention, definitely send that to us. And if you have stories involving interventions or how you denied interventions or something like that, send those to us. We really want to share those on our last episode of our intervention series.
Yeah. Yep.
So,
yay.
So today, like I said, we are talking about pain meds, not physical comfort type stuff. We're talking about actual medicines.
Yes.
Tiffany's just like yawning. We're both just like, we are on this struggle bus over here today, guys.
Oh my gosh.
We're going to make it. Luckily, this is a shorter one compared to the last several in the intervention. So,
yes, thankfully.
All right. So first and foremost, we'll kind of start with the least common. Least invasive. Yeah, least invasive and work our way up. So we're going to talk about nitrous oxide, narcotics, and then epidural. Those are the main pain meds that are offered in the hospital, especially in America.
I put general anesthesia on there as well.
Oh, yes, you did. Yeah. So that'll be an interesting one to get to. And I think that's one that a lot of people don't really think about much. So
yeah.
So nitrous oxide. Tiffany, when you had PACS, did the birth center have nitrous?
Nope, it wasn't even, I don't even think it was an option. Maybe it was, but
I can't remember.
I didn't use it.
Okay, so, but you've had clients use it.
Yeah, I've had quite a few.
And so have I, and it's very hit or miss.
Mm-hmm. Yeah, I always say it's like 50-50 if people like it or not.
Yeah, some people like the nitrous, some don't. But nitrous oxide, it's a gas that's inhaled through a mask. It's very, very similar to the laughing gas you get in the dentist office, but it's just in a different concentration, right?
Right, exactly.
So you inhale this gas through a mask and it can induce a feeling of relaxation and my gosh. Oh my gosh. It can induce a feeling of relaxation and reduce anxiety.
Yeah.
For some moms, it also, sometimes I describe it as like, it just takes like that peak off or like just takes that very top edge off, but it gives mom control over the pain relief because you have control over breathing in or not. You still can have freedom of movement. You can still experience the sensations of birth. And it also promotes conscious breathing, which is kind of cool.
Which I think is like one of the main reasons why it works so well, obviously because of the gas that you're inhaling, but also because you have to focus on the conscious breathing. So you're like taking big, deep breaths whenever you're using the gas. And then also it gives you like a focal point. So you have to be like aware of grabbing the mask, putting it on your face, taking big, deep breaths, putting the mask down. So it also kind of works as like a distraction, I think, too.
Yeah. And so you only use it during the wave or during the contraction. In between, you put it down. And so you have that freedom of movement, but you have to stay within reach of the mask.
Yeah.
But I do agree that breathing is really a really important part of it. Something to know, though, is that it does make some moms nauseous. And some moms feel like they can't breathe when they use the mask. Like I often hear like, oh, I just feel like I can't breathe very well. And so they don't like it. But the coolest thing about this is that it leaves your body within just a few deep breaths.
Yep.
So if you take it and you try it and you don't like it, within a few deep breaths, it's completely out of your body. So it's really cool because it doesn't really go to your baby because it's not in your body long enough to go to your baby.
Right.
And it can have some very minor side effects for mom, but they're gone very quickly. The biggest side effect I like to talk about with nitrous is that it depletes your B vitamins. So if you're someone with the MTHFR genetic mutation, then you want to be really conscious of if you plan on using nitrous, either both leading up to using nitrous during your birth and after your birth postpartum, you want to make sure you're consuming a lot of methylated B vitamins to try to make up that difference. But really,
also that's why it's important to like go through start pregnancy in a really great, healthy state and not like go into pregnancy already being so depleted of everything.
That is so true. And to take a really good prenatal vitamin, like the Full Well vitamins.
Yeah, exactly.
So we really like those vitamins. And there's actually a code in the description, TNBT10. If you want to check out the Full Well vitamins, you can use our code and get 10% off. So that's super awesome.
Yep, they're the best.
They are. And they have all of those methylated B vitamins and they have everything else that you need without all the extra fillers. So So that's a really good way, though, if you do plan on using nitrous to help protect your body during the pregnancy and postpartum. But other than depleting B vitamins and like momentary nausea, there really aren't any side effects of this. Some moms might feel dizzy for a second also. So they don't love it when you are like walking around as soon as you get the nitrous. They want you to test it out and see how you feel.
Right.
But again, that's super momentary. It goes away so quickly. The nitrous can not only be used in labor, but it can be used during all stages. So if you need like stitches for perineal repair, you can try the nitrous to help make you feel better if that's an option at your hospital. Something else to note is that this is not available at all hospitals.
Right. Yep.
We have several in our area, in the St. Louis, Missouri area, that offer it.
Yeah.
But there are several hospitals that don't offer it either. Also.
Right. Yeah.
So this may not even be an option at your hospital. Some birthing centers have it as well, like our birthing center in St. Louis has it. But it starts working immediately. As soon as you breathe it in, it starts working immediately. It's very non-invasive. It's really inexpensive. It's simple. It doesn't require specialized expertise to administer. In the birthing center, like sometimes anesthesia will come down and hook it up, usually, but they don't stick around. They don't like do extra monitoring. You don't have to have continuous monitoring.
That's so funny. I've never been in a situation where anesthesia has come.
Really? No. A lot of times they'll just like bring it down, but then the midwives set it up or whatever.
No, that's funny. No.
Because it's simple. That's kind of the point.
Yeah,
right. It's so simple. You don't have to be on continuous monitoring. You don't have to have an IV, although depending on the anesthesiologist or someone who's on, they may try to tell you have to have one. But like our birthing center uses it and you don't have to be on monitoring. You don't have to have an IV to use it. You can use it in the birthing center.
Right.
So it's really cool. Anything else about that one, Tiffany?
No.
It's a cool option if you have it. It may not be.
Yeah, I mean, I think, it's not as effective as an epidural.
Not at all, yeah.
I think that, like you said earlier, in my experience. I've had a couple clients that have used it just like right at the end during transition, and it's been like so helpful for them. Like you said, like just to get them over that last little bit. Yeah. But then again, I've had other clients who have used it, taken like 2 deep breaths with it, and they hated it.
And they like throw the mask. They're like, I'm not doing this.
Nauseous. It didn't help with pain control. Yeah. But, you know, I do think that it's one of those things like, maybe you're thinking about an epidural, like, okay, well then let's just try the nitrous first. Like, who knows? Yeah. Maybe you're part of that 50% who like really loves it and that's all you need. Yeah. So, you know, it's always worth a shot, I think.
Absolutely. I definitely agree with that.
Yep.
So the next one is the IV or the intramuscular narcotics.
Yes.
This one is sometimes I feel like looked at as a middle ground between a natural birth and an epidural, where they're like, okay, well, I didn't have an epidural, but I needed just like a little something. And so they got IV narcotics because, and here's why it's kind of looked at that way. It typically only lasts maybe 30 minutes up to a few hours. I usually see kind of 45 minutes to an hour. So it doesn't last very long. You can still have a lot of movement. You do have to be in bed. You do have to be monitored. You do have to have an IV. But it wears off quite quickly. So sometimes people want this because they just need like 30 minutes or an hour of feeling a little bit better. And then they can keep going with their labor without pain meds.
Yeah.
I have seen that several times, kind of how people think about that. Other people would much rather get an epidural than do a narcotic because it's a narcotic. They are narcotics. They are given via injection into the muscle or through IV. Most of the time, I think they're kind of done through an IV, but they can be done through the muscle if you don't have like IV fluids or anything hooked up. They can provide moderate pain relief. They are less expensive than an epidural, and they don't require special expertise to administer. So you don't have to have anesthesia come in. Usually the nurse can administer this.
Yep.
So you can get it a little bit faster than an epidural a lot of the time, which is kind of nice. So there are a couple positives there. There are, I feel like, a good amount of disadvantages for an IV narcotic or for a narcotic in general. What do you think?
Yeah.
So they don't last super long, which can be an advantage or a disadvantage depending on what you're wanting.
Right.
They are linked to maternal drowsiness, nausea, and vomiting. I have a lot of clients say...
Also itchiness.
Itchiness, yep. I have a lot of clients say, I could still feel the pain, I just didn't care.
Right. And it's because, okay, you can edit this out if you want, but like, it's literally because you're high.
Yeah. I mean, that is like, that's pretty much what it is.
It's what it is. Yeah. You are feeling the pain, but you just like don't care because you're high. Yeah.
Yeah. And then for the same reason, a lot of people don't like it because they say they feel like they were out of control, like or they couldn't gain control. They felt drunk. Or high, and they don't like that feeling. It made them feel like really uncomfortable. So it's like the nitrous where you don't know how you're going to react to it. Luckily, again, it wears off fairly quickly. Another disadvantage, or just something to know about it, I guess, is that the narcotics, you have to have like a time span between getting another dose. So like I had a client who had several doses of Nubane during her labor, and she had to go 4 hours between each dose.
Yeah.
And then subsequent doses don't always work as well as the first dose. So it just, again, it's very individualized how this is going to affect you and how you're going to feel about this. It can lead to medicalization of birth. So that, like I said, the continuous monitoring, being restricted to bed, having a lot more, at least IVs, at least temporarily. Once it's kind of out of your system, a lot of the times they will kind of back off on that. But a lot of times once you're restricted and monitored, they don't want to back off of it, you know? And then all narcotics and opioids, they cross the placenta. So it does go to your baby. And a potential adverse reactions for that are increased respiratory depression of baby, abnormal fetal heart tones, poor muscle tone, drowsiness of baby if you get these too late in labor. And that's something else, is a lot of times hospitals don't want to give these if you're like 7, 8, 9 centimeters. They want you to be earlier in labor to give these because they don't want to risk you birthing baby with narcotics in their system and then baby struggling to breathe when they're born. Yeah, so they're definitely not able to be given during pushing because of that. And it just kind of, different hospitals are going to have slightly different policies, and different hospitals are going to have different narcotics available. Mm-hmm. The 4 most common ones I see are Nubane. Well, Nubane's not super common. I've only seen that at one hospital, but fentanyl, Stadol, and Demerol. Is that all of them, or is there another one, Tiffany?
No, I think that's all of them. I'm not super familiar with these because I've never had any clients get them.
Really?
No.
I've had a few.
Nope. Yeah. Nope. None that I can remember in the past, 6 years. Yeah.
Wow. I've only had a handful. I've had maybe 4 clients, 5 clients use it. I had one who was a home birth transfer, and this was fairly recently, and she's a redhead. Mm-hmm. And she transferred into the hospital, and we were struggling. The home birth practice was struggling to get her records fully transferred over. Mm-hmm. And then the hospital wanted to draw blood work and get the blood work back before they'd give her an epidural. Mm-hmm. So luckily the doctor who we transferred into was really compassionate, and he very quickly authorized a narcotic for this mom. Yeah. But because she was a redhead, she got the narcotic and felt nothing. Like she did, no change. I mean, it did not touch her. She was like, right. Did you give it to me yet? And they were like, yeah, we gave you a shot. She was like, I don't feel any different.
Yeah.
He was literally saying, okay, you can give her another dose. And then her blood work came back and she got her epidural.
Oh, good.
But for her, it didn't work at all. I had another mom who had 3 or 4 rounds of Nubane and was able to avoid an epidural because she had the Nubane, and she had a really, really long labor.
Yeah.
And then I had one other mom who was 7 centimeters, and they went ahead and gave it to her, and she had her baby within an hour, and they were actually really kind of concerned about baby when she started pushing. Luckily, baby was fine.
Oh, good.
But it was a concern with the staff. They were like, oh, we're going to have to get NICU up here just in case because you just had that dose.
Yeah.
It is just something to consider. It is a narcotic. It does cross the placenta. And I mean, if you've had any history of drug usage, or if it's, even not that this is good, but if mom was using drugs while you were in the room or something, you are at a higher risk for becoming addicted to those narcotics. And so then having it in labor, that's something you want to consider. Mm-hmm. And that's a really sad thing to have to consider, but it is something to consider because these drugs are very addictive.
For sure. Yep, I agree.
So you just want to be aware of that.
Do you want me to go over epidural in general?
Please.
Okay, yeah. Next is epidural. So an epidural is done by inserting a needle and a small catheter into the lower back of a woman while she's in labor. The needle is pulled out, the catheter stays in, and gives the woman a small continuous administration of medication to mom. Most epidurals, at least that I see, are also hooked up to a personal pump as well, where mom can press a button intermittently to administer more medication at certain time intervals. The medication given in the epidural is typically some sort of numbing medication that numbs you first, and then an opioid. A lot of people don't know that they're giving you fentanyl in your epidural. Yeah. Stronger medications or more medication can be given through the catheter if the mom needs it. And it does have fewer side effects, when you're comparing epidurals versus IV or IM narcotics. The good thing about epidurals is that they are typically highly effective. They're widely available. You can usually get them, within 15 minutes if you request it. But again, it can, just like all of these things, can lead to the medicalization of birth. So you're required to have IV fluids. You're required to have continuous fetal monitoring. You have to stay in bed, at least in our area. So that definitely is a downside.
Well, and something else to say, it has fewer side effects, but I also feel like epidurals tend to lead to more of a cascade of interventions than narcotics do.
Right. Yes.
So it's
we're going to talk about that. Yep.
Oh, cool. Okay.
Yep.
Should have read ahead.
No, it's okay. So some disadvantages. And I think that a lot of people get this confused, right? They think, oh, I'm going to get an epidural, so I'm not going to feel any pain. Well, that's not true. The epidural may not take all of the pain away that mom is experiencing, or it may only take pain away on one side of the body. If the anesthesiologist or CRNA who administered the epidural did it the correct way, you should still be able to feel pressure in your body as baby is descending through the pelvis. I know that there are some moms who don't feel that, but really, ideally, you should be able to feel that pressure.
Pressure. And some moms will still feel the urge to push, but a lot of moms won't. It just depends.
Backed by the most up-to-date science and research, we bring you the best prenatal on the market. Full Well is an amazing prenatal vitamin formulated with the best of the best ingredients and bioavailable nutrient and mineral forms that help to fill in nutrition gaps for mom and baby. These prenatal vitamins are tested for consistent dosing and heavy metals and then verified by a third party for every single batch. That way, you know what you are buying is truly what you need.
Not only does Full Well have an amazing prenatal, they also carry women and men's fish oil, a men's multivitamin, a fertility booster, and an amazing Nourished Nerves calming tincture, which is one of our favorites. We are both so happy to announce that we can offer you guys a 10% discount on your first order. So you just have to use the code TNBT10. So that's the Natural Birth Talk, TNBT10. The link is in the description below. You can insert that code into the coupon code box to save. Hey, Tiffany, do you have any tips for someone who pee-pees their pants a little bit when they say jump or sneeze? I'm just asking for a friend.
Actually, I have a fantastic suggestion that can be done in the comfort of your own home and was created by published researchers with a background in exercise physiology and physical therapy. It's called Tighten Your Tinkler.
Oh my gosh, silly name, but it must have some serious results.
Yeah, learn more by listening to the audio testimonial in the description or use code TNBT50 for $50 off the signature program.
Hey listener, do you want a comprehensive yet concise and inexpensive online at your own pace natural birth education course to help you prepare for natural birth, pregnancy, and postpartum? Then check out the description below for that and our helpful products guide. Now back to the show.
Yeah, see, I don't know. I feel like recently I've had, when I'm trying to think, I think I had 3 clients who got epidurals last year, 3 or 4, and all but one felt the urge to push.
That's great.
Yeah. And the one, her epidural was funky anyway. She was having breakthrough, a lot of breakthrough, patchy pain in one area. And I just think that CRNA who did it didn't do a good job. So more disadvantages to an epidural. And this is what I kind of see a lot. I'm sure you do too. Longer pushing stage.
Yep.
Obviously, we know that there's an increased need for C-section with epidural, an increased need for Pitocin augmentation.
Yep.
So I know we've kind of talked about this before, but anytime you get opioids, it messes with the production of certain hormones in your body, which can lead to your labor slowing down. So that's why that happens.
And an increased risk for postpartum depression too, since it messes up your hormones.
Yep. So increased need for C-section, for forceps, for vacuum. Something really commonly that happens with epidurals is as soon as not as soon as, but when they're administered, they can lead to low blood pressure in the mom. And whenever low blood pressure happens in mom, it decreases the blood flow to the placenta and therefore to the baby. So it can lead to low fetal heart tones.
And they try to combat that with giving you IV fluids before you get the epidural.
Right. But that doesn't always work.
Exactly. It does not always work.
So then they have to come back in and give you more medication.
Yep.
To counteract that.
I had a mom just 6 months ago or so, and she got the epidural and her baby's heart rate plummeted. Plummeted. And her blood pressure was already a little bit low. And they were blaming her blood pressure, but her blood pressure really hadn't changed. And so it was really interesting because they kept saying, oh, it's your blood pressure. I'm like, her blood pressure really doesn't look that much different than it did before. But for whatever reason, baby's heart rate plummeted and was not wanting to come back up. And they gave her terbutaline to stop her contractions. They gave her an IUPC, so an internal pressure catheter. They gave her the internal monitor as well that screws into baby's head. And they started prepping her for a C-section. She had a dose to start prepping her for a C-section. And then, thank God, all of a sudden baby's heart rate came back up. And so just slowly people started trickling out of the room. This was at a hospital that is, and with a care provider who really has a good low C-section rate, the care provider specifically. I think at any other hospital, she would have been in a C-section. And it would have been because of her epidural. Luckily, she was in a very patient hospital with very patient care providers. But it really did. Like I saw it, that epidural almost was seconds away. I mean, literally 30 seconds away from causing her to go back for a C-section.
I had a client over the summer who that happened to. She had a really long, she was planning a home birth. We had been there for, I don't know, 2 or 3 days. She finally transferred to the hospital because she just was so exhausted. She was 10 centimeters, but she just was so exhausted. She had no energy. She got an epidural. And I mean, it was within 30 minutes probably. That baby's heart rate tanked and it wouldn't come back up. And it was because of her blood pressure. It was because of her blood pressure bottoming out. And she did end up having a C-section.
That sucks.
But sometimes those kinds of situations are unavoidable,
right,
I mean,
absolutely.
She was so exhausted, and at that point it really was the safest way to get her baby out, because she certainly would not have had the energy. And they did try pushing too. We tried pushing before, because the doctor came in and was just like, you know what, let's just see if we can get this baby out, and then that's the end of it and it's fine. But unfortunately that did not happen. So another really common thing that people don't talk about is getting a fever when you have an epidural. And this can be particularly a pain in the ass, because they treat you as if you have an infection when really you don't have an infection. It's because of the epidural, but they don't want to risk you potentially having an infection.
Right.
And there's no way to tell usually until after you've had the baby. And they do blood cultures on the baby. It's just it's just the whole thing.
It leads to a lot of intervention that way too. Yep, because they want to do antibiotics on you, and then they want to do antibiotics on the baby, and then they want to test the baby, and then
it's a whole thing. Lasting numbness and tingling in the back. I hear this a lot from a lot of people.
Yes, or even pain at the injection site.
Years later. Itchy skin is very common. Nausea and vomiting. That's obviously because of the opioids. And then
spinal headache.
That is it obviously can happen, but it's a small chance that it can happen.
I want to say it's like 3% or something.
Yeah.
I think it's I think they usually say 3%.
And I mean, honestly, like if you think about how many people get epidurals, it's a very small chance.
Yeah. But it's like the worst headache of your life.
For sure. Right. Infection at the insertion site. And then, like I said, we already talked about that increased need for Pitocin augmentation.
And something else to remember with any of these options, maybe not so much with nitrous, but definitely with the narcotic and the epidural, there's always the possibility of an allergic reaction.
For sure.
That might come out of nowhere. And then they also tend to cause breastfeeding issues with baby. There's a lot of
that's interesting.
long-term...
I didn't type that on here, but whenever I did my CLC training, we were taught moms without epidurals, expect them to nurse within 1 hour. Moms with epidurals, expect them to nurse within 2.
Yeah. And I feel like that is quite common. Like that is like pretty accurate that you see that because babies are sleepier when they're born with an epidural, or if they do happen to have narcotics. And also, like I kind of already said, and it's very not mentioned at all, but epidurals can increase your risk of postpartum depression because of the way they affect your hormones. And so that is something that's really important to keep in mind. I had a friend who with her first 2, she had epidurals and she had really bad postpartum depression. And with her third, she had a water birth and didn't have an epidural, and she did not have postpartum depression. So, maybe coincidental, but I feel like I see that a lot.
Yeah.
It is definitely a possible side effect. And a lot of these things, doctors or nurses will say like, no, it doesn't slow down your labor. No, it doesn't increase the need for a C-section. No, it doesn't increase the risk of postpartum depression. No, some people even say, no, it doesn't go to the baby.
Yeah, they do say that. And it's but it does.
It definitely does. It definitely does. That's why you have to stay on monitoring.
And here's the thing. The blood pressure they do it to make moms feel better about getting the epidural. But like, it's okay to also know the potential risks, right? Like that's not informed consent if we're just lying to moms and saying, oh no, your labor's not going to have to be sped up. No, it doesn't slow down your labor. No, your baby's going to be totally fine. At the end of the day, we don't know that, So like, I understand we're trying to do it to make moms feel better about their decisions, but also we shouldn't be lying to them.
Absolutely. They need to have the full information. And that's why we're doing this episode. And I have another episode similar to this one from my first season of doing the podcast. It's with Tiffany and I's friend, Brittany. And so we have one about like why you wouldn't want to get an epidural. And in that episode, I think Brittany goes into studies a little bit more.
Which there are.
Yeah, and there are a lot of studies. So if you're into this episode and you want to learn like even more, you can go back to that old episode in the first season. It's titled No Epidural, Why? And that's with doula Brittany Sisko. So that's another one you can check out. But one thing we did not talk about in this episode is the last pain med we want to talk about here on the list.
Oh, yes. General anesthesia, which is not something that's commonly done. It's rarely used in labor because usually labor requires you to be alert during the process. You have to be like an active participant, even if you have an epidural or whatever. So this is only usually done in cases of extreme emergencies. What?
I want to pause that. Something else we didn't say about an epidural is that often there's increased tearing.
Oh, yeah. Yep.
Yeah, right, because you have to push so hard that you can't like feel to slow down a lot of the time, or the doctor assists more with their hands or even with a forceps vacuum. There's often increased tearing with an epidural and longer recovery a lot of the times too, because your body has to detox from the meds and recover from birth then. So that is something else that's really common. Sorry, back to general anesthesia.
It's okay. So general is usually only given in cases of extreme emergencies. So even though, I mean, at least in my experience, like even though hospitals are like very much pro epidural, they aren't pro general anesthesia.
True.
I mean, so true. That's one thing like I will give them. This is not something that they want to do to you or your baby. What were you about to say something? Oh,
I don't think so.
Okay.
I'm just yawning.
So, you're fine. So how it's administered. So mom is typically given like a muscle relaxant. Then mom is asked to inhale a gas that will help make her fall asleep. So then a tube is inserted into her airway to keep her airway open. And then that allows them to breathe for you. And then it also allows them the option of giving you more medications, through that tube. So the only pro that I can really think of is that it has the potential to be life-saving in certain situations. So, I personally have seen this happen one time. And I truly believe it was life-saving in this certain situation.
Yeah. I don't think I've ever had a client go under general, which is good. But it's like, I'm assuming in your situation too, like it's like, we got to get this baby out and we got to get this baby out now. You don't have an epidural or it's not dire. Yeah.
It was dire. Yeah. That baby got out as soon as possible.
Yeah. So if you have an epidural already, a lot of times they just use your epidural and they don't have to put you under general.
Right.
But if your epidural is not cutting it when they get back to the C-section, they'll put you under general. That happened to my sister-in-law, where she could still feel everything even with her epidural. So they ended up putting her under general. And then if it's like you don't have an epidural and this baby has to get out now, like it's dire, they just put you under general. They don't take the time to do the epidural because it's too long of a process.
Yeah. So, and then obviously there are cons. There are many cons. So for mom, I think one of the hardest things is that mom doesn't necessarily wake up right away post-birth. So she might actually be awake, but she's not coherent.
Right.
In those first few hours, it takes some time to like get mom awake and coherent and roused. So that can be really hard because nursing, that golden hour, all of those things can be interrupted because of that.
Yeah. I just don't know if we said this yet. So we keep saying general and it's an emergency and we got to get baby out quickly. But that getting baby out quickly means you're under general and you're having a C-section.
Right. Yes.
I don't know if we said that.
I don't know. We probably didn't. Didn't say that. But yes, you're having a C-section if you're under general anesthesia. Recovery can be more painful because most often, if you're under general anesthesia, you didn't have an epidural. So the epidural, whenever you get that during a C-section or a spinal, that lasts like a certain amount of time. That pain medication covers like 8 or 12 hours. Under anesthesia or under general anesthesia, they put you to sleep and then you don't have that pain medication to cover you. Of course, they can give you pain medication, but then that's usually like IV or IM narcotics.
Right.
You're not getting that coverage that is like numbing you from your waist down or whatever.
Right. Well, and to be honest, like who wants to be on narcotics when they first get to see their baby?
Yeah.
Like, I mean, I understand why they do it, but it's so like
in my
hard.
client's situation, she was in it was really horrible, extreme pain for her.
I believe it.
I think that, she, obviously she would have rather had a spinal or an epidural.
Oh yeah.
She was in severe pain. So it was hard for her sometimes to even be able to hold the baby or nurse the baby. And she was in pain for, quite a few weeks afterwards.
That's so sad. I mean, I'm grateful for it that it saved mom and baby, but it's still sad.
For sure. Yeah. So yeah, recovery can be quite a bit more painful. There is an increased risk of postpartum mood disorders, like we kind of talked about. And that could be for a number of reasons, because it messes with your hormones, because you don't get that, initial skin to skin contact with baby. There is a delay in breastfeeding for baby, which obviously can affect mom. There is an increased chance of low APGAR scores for baby, which is a score that baby gets at 1 minute and 5 minutes of life. There is an increased risk of baby being admitted to the NICU. And then there is an increased risk of breathing issues. And a lot of those risks are risks for baby in just a C-section in general. It's not necessarily strictly related to the general anesthesia.
All of these things have a time and a place.
For sure.
It does have a time and a place, but you really just need to be educated on the potential pros, the potential cons. They all have cons.
Right.
Barely Nitrous does. Nitrous barely does. But the other ones all have cons. And you really have to weigh that. And we just want you to have the full information. And to be honest, there are probably potential side effects that you and I haven't even mentioned.
Oh, for sure. Yeah.
Because these things are very serious drugs. They're very serious drugs, and they are used way too often, to be honest, and without informed consent, truly informed consent. So you just really want to know your information ahead of time and really consider your options. Something to say about an epidural is, and probably narcotics too, really, the longer you can wait to get the pain meds, even if you want the epidural, the longer you can wait, the less chance of there being some of these side effects. Yep. So if you can make it to 7 centimeters without anything, I mean, chances are your baby might be right around the corner anyway. Yeah. But if you can make it to 7 centimeters or whatever before getting in the epidural, instead of getting it at 3 or 4 centimeters, you have fewer chances of that maternal fever. You have fewer chances of a low blood pressure issue. Another thing with an epidural is you're not supposed to eat. We didn't say that. Some studies are coming out that you can have light snacks, but most hospitals will only let you have clear fluids with that.
Yeah, but I don't know. It's so dumb for that, because the reason why they say that is because having an epidural increases your risk of having a C-section. Yeah. So they don't want you to eat whenever you have an epidural, but it's silly because what happens when someone comes in an emergency and needs an emergency surgery?
Right. You don't know if they've eaten or not.
Right. So eat your snacks, guys. It's fine.
I agree. The other thing is, if you have a long epidural, if you have an epidural for a lot of hours, it does kind of shut down your digestive system. So that's kind of another reason they're don't really eat. But I mean, I'm not going to say I've never had a client eat with an epidural. You gotta stay fueled.
Listen, I'm pro eating regardless of the situation. I don't care.
I really am too. But the hospitals are not. So that is something that, especially if you're a rule stickler, and a rule follower, you really want to be aware of that. The rule is that you're not supposed to eat.
Also, I want to say too, epidurals aren't always bad, right? Yeah. I know, Rachel, you've been in these situations too, where it has been such a useful tool to get baby here. I've had situations where it actually sped up the process. Mom had tightness in her pelvic floor, and she wasn't able to fully relax or was having trouble doing that. And she got an epidural and literally an hour later had a baby. You know what I mean? So they're not all bad. Sometimes the benefits outweigh the risks, and that's totally okay. But all we're saying is that you should be the one to determine that. Yeah. For you and your baby, you shouldn't be coerced into anything. You shouldn't be pressured into anything. You should be able to have true informed consent when talking about these options. Absolutely. And these are all the options that we've talked about in the whole intervention series, not just in this one. So
absolutely. One last thing that is sort of relevant to this that I want to bring up is that if you're a VBAC, so a vaginal birth after C-section, a lot of care providers want you to get the epidural just in case. Mm-hmm. And that is because if you need a C-section for like a uterine rupture, which is incredibly rare, but if you do, then they can use the epidural instead of having to put you under general anesthesia. I think that's a red flag. Like if you have a care provider that's saying you have to get the epidural or we really want you to get the epidural, that is a bit of a red flag that your care provider...
Not a bit of a red flag. That's a huge red flag.
That your care provider may not be as supportive as you thought they were. So you want to look out for that. Yes, because it's definitely a red flag. It's, you know, and we're not going to get into all the red flags of VBACs right now, but I just want you to be aware that that is why they want you to get the epidural, because they are afraid, they're scared. Mm-hmm. They're scared of the VBAC. And so they want the epidural there so that if you have to have a C-section, they can use the epidural instead of general.
They're all scared of everything.
Well, yes, absolutely. I mean,
it's so annoying.
Like, you want to find,
if you can find this job.
Yeah, if you're afraid of it.
Whatever, that's a different story for a different
day. It is. Just remember, your OB is a surgeon.
Right, exactly. Yeah.
Okay, so we are getting
specialty. Yeah, okay.
Just a little
right, we need to bring it around. Okay, thank you so much for joining us in this beautiful intervention series. I think that's all we have for today.
I think it is. Again, guys, send us your questions or your stories. Maybe you have a story about how an epidural or a narcotic was amazing for you. Maybe you have a story about how it sucked. Yeah. Maybe
we want to hear all of it.
Maybe you had a side effect that we didn't mention. Or maybe you have a question about things. Just send it all over to us. contact@thenaturalbirthsite.com or on social media. It's at the Natural Birth Site on Facebook and Instagram. We really want those stories. We really want those questions. So thank you for listening. We hope you all have a great day.
Yes.
We hope that you're all a little more awake and alert than Tiffany and I have been.
Maybe we should have an episode where we just rant about things that piss us off about birth.
We really need to do that. We could turn that into a series too.
I know, right?
Especially if we had like Stephanie and Victoria as our friends join us.
Yes, we should. And it could just be a ranting video. Okay, guys, we're going to work on this.
We'll get that up eventually. Maybe by the end of the year.
Yeah, right.
All right. Thanks again for listening, guys. We'll talk to you in the next episode.
Bye, everyone.
Bye. Hi, Rachel Manns again. If you want to learn more, please subscribe to and rate this podcast and head over to thenaturalbirthsite.com to check out our online natural birth education course, birth story blog, YouTube channel, and more.